Hi, my name is Kristen Adelson and I'm a mental health therapist with about 15 years of experience. Dr. Hall Finley asked me to speak to you today about mental wellness and emotional wellness after cosmetic surgery. She wanted me to speak to you from a therapist perspective, but also from a personal perspective. I first met Dr. Hall Finley during my consultation when I decided to inquire about abdominoplasty after weight loss. And I ended up having my full tummy tuck done in November of 2016. Following my surgery, during the recovery period, I noticed that I was a lot more emotionally sensitive. And I was actually surprised that the recovery was both emotionally and physically as difficult as it was, despite the fact that Dr. Hall Finley tried to prepare me for that. Fortunately, before surgery, I took some steps to make it a lot more easy for me mentally and emotionally, and I really encourage you to do the same. And I'll tell you a few things about what I did, and hopefully it will be helpful for you. One of the first things I made sure to think about and even look into a little bit was having some realistic expectations of the results. Dr. Hall Finley actually took great care in making sure that I was having the right surgery for the right reasons. No matter what type of cosmetic surgery you have, most people expect and do experience an increase in self-esteem and confidence. It has some limitations if you expect it to fix your entire life. When you're considering the changes you want to make in your appearance by going through with surgery, make sure that they're internally driven. Your reasons for doing it are your own, rather than externally driven by someone else. Something I found that was really important was to identify a support network, and I think you will too. The staff here at Banff Plastic Surgery and the nurses, everyone takes really good care of you here, and they do check in with you regularly. In addition to that, though, identifying your own personal supports would be really important. So maybe that's a spouse, a friend, a family member, or all of the above, just to ensure you have the help you need. The first little while, you're going to need help with maybe moving around, making meals, and childcare. Sometimes asking for help is really hard. Remember that asking for help and receiving help is about your recovery, is about your healing, and it's super important. So allow yourself to do that. Never be afraid to access professional help, whether it be a counselor, a therapist, a nurse, whomever it is. A couple sessions with them can be really helpful, just to help you get back on track. Another thing I did was, before surgery, I made sure that my environment was set up so it was conducive to healing. I actually made sure I had a reclining chair, magazines, books, whatever I needed was in my vicinity. They do encourage you to get up and walk around, but make sure that you have a nice comfy spot where you can rest. If you're anything like me, and you are super busy and you like to stay super active, you might find it hard to make yourself get the rest you need. You might find yourself getting frustrated, bored, or even feeling guilty that you're not being as productive as you usually are, especially if you have kids. Employ some self-compassion here. Self-compassion, and just be kind to yourself. Treat yourself like you would a friend who is experiencing the same thing. You wouldn't make your friend get up out of the chair and run and make dinner and clean the house or do laundry. So don't do that to yourself. The rest is really important for your recovery period. In addition to that, don't be a tough guy like I tried to be and take your medication. When I first came back from the hospital, I tried to skip some pain med doses, and that was not a smart idea. I quickly realized that they prescribe that medication for a reason. An increase in pain can have a real detrimental effect on your mood. It can make you irritable. You can start feeling even hopeless. The pain will also make it more difficult for you to focus on the positive things. So it'll make it difficult for you to look forward to the positive results that you can expect. So do take your pain medication. One last thing to remember is healing takes time. You're going to experience bruising and swelling. The nurses and whomever is doing your surgery they're going to prepare you for that. But make sure you remember that when you look in the mirror, just have some patience. I remember thinking at one point, oh my goodness, what have I done to myself with the bruising and the swelling? But focus on the outcome, focus on the positive results at the end of the day. I honestly couldn't be happier with my results. It's 7 months later now, and my expectations were exceeded. First time I've been able to wear a two-piece on the beach, so that's pretty cool. You know, looking back on my entire journey from the day that I decided this is what I wanted to do, researching who I wanted to get it done by, finding Dr. Hall Finley, going ahead with the procedure, the recovery, which at times was difficult. Looking back at all of that, I would actually do it again in an instant. I'm really grateful I had the opportunity to do this video. Thanks for joining me, and I hope you found all of this helpful.